Hello everyone, welcome to Forensic Extract, and today we will be discussing about age estimation. So please do subscribe to Forensic Extract and please press the bell icon for getting notifications related to each video. So age estimation is required in various civil civil cases to decide or determine criminal responsibility, or in various cases in which maturity has to be determined, cases related to sexual assault, and various cases related to kidnapping, abduction, and all, and in some cases in which juvenile is involved. So, for the purpose of age estimation, every institution is having their own performa in which the name of institution is written on top, then the date and time, then the particulars of the person examined, then the name of the brought by and details of brought by or person accompanied. Then consent has to be taken. It should be detailed, written, and witnessed consent that has to be taken for the purpose of medical examination and related investigations for age estimation. Now, after consent, one has to write marks of identification. Minimum 2 marks of identification should be written, and it should be on the exposed areas of the body. Now, after marks of identification, one has to write alleged history, brief alleged history related to the crime or offense. Then the general physical examination, in which we will use Turner's staging or the sexual maturity rating staging. Turner's was a British and pediatric endocrinologist who devised Turner's staging system, which we will discuss in next video. And beside tennis staging, one has to write height, weight, and the chest circumference of the person examined, both in inspiration and expiration, and abdominal girth at the level of umbilicus. Then the nature of voice, whether it is the low pitch voice or high pitch voice. Then the presence of Adam's apple, whether it is present or absent or present. So these findings has to be noted. Now, after a general physical examination, we'll go for dental charting. That is done by using various charting formulas or methods, like if you are using Palmer's notation or the FDI or modified FDI system, or some other systems like Zsigmondy, Cunningham's Navy system. So in Palmer's notation, we'll use numbers for permanent dentition for each quadrant. This is right side, this is right upper quadrant, this is right lower quadrant. Similarly, this is left upper and this is left lower quadrant. But in case of deciduous dentition, we will use A, B, C, D, E for the purpose of dental charting. So this is single digit system, that is Palmer's notation. Then the FDS system, it is the 2-digit system, that is first digit that depicts the number of quadrant, that is 1, 2, 3, and 4, followed by the number of tooth like 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6, 1, 7, 1, 8. Similarly, this is for permanent dentition. For the purpose of temporary dentition, one has to write 5, 6, 7, or 8 in FDS system. And in case of modified FDI system, the quadrants are numbered as 1, 2, 3, and 4 for permanent dentition, and 5, 6, 7, or 8 in case of deciduous dentition. These are the formulas for dental charting. Now the age of eruption of deciduous as well as permanent dentition. So first is the central incisor, just that appears at the age of 6 to 8 months. Lower central incisors 6 to 8 months. Then the upper central incisors at the age of 7 to 9 months. Then the upper lateral incisors at the age of 7 to 9 months. Then the lower lateral incisors at the age of 10 to 12 months. Then the first molar appears at the age of 12 to 14 months. Then the canine appears at the age of 17 to 18 months. Now the second molar, which appears at the age of 20 to 30 months. So this is the eruption of deciduous dentition. Now the permanent dentition, central incisors. First is the first molar that erupts at the age of 6 to 7 years. Now the central incisors that erupts at the age of 6 to 8 months, 8 years. Now the lateral incisors erupts at the age of 7 to 9 years. Now the first premolar that erupts at the age of 9 to 11 years, and second premolar that erupts at the age of 10 to 12 years. Now the canine, which erupts at the age of 11 to 12 years, and the second molar that erupts at the age of 12 to 14 years. Now what happens after 14 years? Jaw grows posteriorly and there is increased angle between ramus and the body that creates space for third molar, and third molar erupts at the age of 17 to 25 years. So this is the age of eruption of both deciduous as well as permanent dentition. Now something about radiological examination. So for the purpose of radiological examination, one has to send X-rays for identification of appearance and the recent fusion and the complete fusion of various ends of long bones. So center first is the appearance of the center, then the recent fusion that appears as a translucent line that is known as epiphyseal scar that shows a recent fusion. Then complete fusion is shown, it appears at the ends of the bone that is completely united with the shaft. So for the purpose of radiological examination, one has to send various X-rays like for shoulder, AP views, and X-rays of various long bones, whether these are AP and lateral views, and all joints involved. Now one has to know the age of appearance as well as complete fusion. So we will start from upper limb, then we'll go downward uh, and involve lower limb. So in upper limbs, first is the humerus. So in humerus, the center for head appears at the age of 1 year, and center for greater tubercle that appears at the age of 3 years, and center for lesser tubercle appears at the age of 5 years. And these three centers uh, fuse and forms upper end of humerus that is around the age of 18 to 19 years. And the lower end of humerus is quite complicated because it is formed by the middle epicondyle and trochlea over there, then the capitulum, and then the lateral epicondyle. So center for capitulum appears at the age of 1 year, and center for trochlea appears between the age of 9 to 11 years, and center for lateral epicondyle appears at the age of 11 years. Then all these three centers unite with each other and forms a conjoint tendon or conjoint epiphysis at the age of 14 to 16 years, and that unites with the lower end of humerus at the age of 16 years. Now the center for medial epicondyle appears at the age of 6 to 7 years, and it unites with the lower end of humerus at the age of 16 years. So complete elbow joint forms at the age of 16 years. Now these radius and ulna. So this is radius and this is ulna. So center for lower end of radius appears at the age of 2 years, and center for upper end of radius appears at the age of 5 years. Then center for lower end of ulna appears at the age of 6 years. Then center for upper end of uh, ulna appears at the age of 9 years, that is olecranon process. Now these upper ends of radius and ulna unites with the shaft at the age of 16 years, and the lower end of ulna unites with the shaft at the age of 17 to 18 years, and lower end of radius unites with the shaft at the age of 18 to 19 years. Now the elbow joint, so the wrist joint. Wrist joint is having various. This is metacarpal, first metacarpal. Then we are having scaphoid, lunate, triquetral, and pisiform. Then trapezium, trapezoid, capitate, and hamate over there. The center for pisiform is appears between the age of 9 to 12 years. Then center for scaphoid at the age of 5 years. Then center for lunate at the age of 4 years. Then center for triquetral at the age of 3 years. Then center for trapezium appears at the age of 6 years. Then center for trapezoid at the age of 5 years. And center for capitate and hamate and at the age of 3 months and 2 months respectively. 2 months for hamate and 3 months for capitate. So the point to be remembered is the at the age of 1 year only 2 carpal bones are there in wrist joint. Now the center for head of the first metacarpal unites with the shaft at the age of 15 to 16 years. So these are the joints which are important for age estimation in the wrist joint. Then we will study the appearance and fusion of various joints in the sternum. So this is sternum bone is made up of various sternbri and the manubrium sternum and Gifford process. So total 4 sternbri are there. Now the centers for sternum appears. The first center for manubrium appears at the age of 5 months. Then center for first sternbri appears at the age of 5 months. Then center for second sternbri appears at the age of 7 months. Then center for third sternbri appears at the age of 7 months. Center for last sternbri appears at the age of 10 months. And center for Gifford process appears at the age of 3 years. So this is the primary wave of appearance that is from above to downward. Then the secondary wave of fusion for the body of sternum or the mesosternum is from below to upward. Between last and the second last sternbri at the age of 15 years, then between the second and the third sternbri at the age of 20 years, then the first and the second sternbri at the age of 25 years. So at the age of 25 years, the body of sternum is found completely formed. Then the center for Giffy unites with the mesosternum at the age of 40 years, and center for manubrium sterni unites with the body of sternum at the age of 60 years. So this is about sternum. Then the various sutures, skull sutures. So we are having this is sagittal suture. Sagittal suture fuses in 3 parts, that is the posteriormost 1/3 at the age of 30 to 40 years, then the anteriormost at the age of 40 to 50 years, then the middle third at the age of 50 to 60 years. Now the coronal suture that fuses into 2 parts, that is the lower half at the age of 40 to 50 years and upper half at the age of 50 to 60 years. Similarly, lambdoid suture also fuses into 2 parts, that is the upper half at the age of 50 to 60 years and the lower half at the age of 60 to 70 years. Now the first suture to fuse in whole skull is between the basi occiput and basi sphenoid. This is the first suture that fuses between 18 to 19 years of age. This is the first suture to fuse between basi-occiput and basi-sphenoid in the skull. Now after skull, we'll go for lower limbs. So in lower limb, we are having femur and the tibia and fibula. So the center for femur, this is femur bone. This is femur, and it's having head, one greater and one lesser trochanter. So center for head appears at the age of 1 year, and center for greater trochanter at the age of 4 years, and center for lesser trochanter between the age of 12 to 14 years. Now this complete fusion of all three centers at the age of 17 to 18 years. Now this is femur, and we are having tibia. This is tibia, and this is fibula. So lower end of femur, center for lower end of femur appears at the age of 9 months, and center for upper end of tibia also appears at the age of 9 months. And center for lower end of tibia appears at the age of 1 year, and center for lower end of fibula appears at the age of 1 year. 1 year. Then the center for upper end of fibula appears at the age of 4 years. Now these two centers unites with the shaft at the age of 18 to 19 years, and the lower end of this tibia and fibula unites with the shaft at the age of 16 to 17 years. So this is about femur and tibia and fibula. So some medico-legally important centers are also there in foot also, that is the center for calcaneum, which appears at the age of 5 months, so that it is very important to decide the that at the age of 4 months sex can be determined, and it is medically important for female feticide. Now the center for talus appears at the age of 7 months, that is the period of viability. So these two centers are medically important in foot. Now we'll go for pelvis. So this is pelvic bone. It's having uh, ilium, ischium, and pubis. Now the pubis bone is also having, this is ischial tuberosity. So this is the center for iliac crest that appears at the age of 14 years and completely fuses with rest of the bone between the age of 20 to 21 years. Now this acetabular cavity fuses by formation of a cartilage involving three bones, that is first the ilium, then the ischium, then pubis. This is ischium, this is pubis. That's why it is called as triradiate cartilage. The center for triradiate cartilage appears at the age of 13 years, and it completely ossifies at the age of 15 years. Now center for ischial tuberosity appears at the age of 16 years, and it completely ossifies at the age of 20 to 21 years. Now center for ischiopubic rami appears or completely fuses at the age of 6 to 7 years. So these are the centers of appearance and fusion in pelvis, which are important for age estimation. So this is about the age estimation and appearance and fusion of various joints in upper as well as lower limbs. So as we have discussed, for the purpose of age estimation, we need general physical, dental, and radiological examination. So based on all these three findings, we have to give the age range for the person or the individual examined. And the final part is the opinion writing. based on the general physical, dental or radiological examination, you have to give opinion regarding the age, that the age is between the 16 to 18 years or 12 to 14 years or so on, based on the findings, or correlating general physical, dental or radiological examination findings. You have to give age in various ranges. So age estimation, age estimation is done by whether forensic experts or medical legal expert or some other general physician and all, and it is medico legally very useful or required in court of law to cross check the age of person examined. So one has to write the all the findings related to age perfectly, so that age can be given in certain range. So this is all about age estimation, and in next video we will discuss about tenor stitching. So thank you guys, and please do subscribe for forensic extract, and please keep on watching. Thank you.